The Pre-Hospital Emergency Care Council has commissioned this DVD to standardise the approach by examiners to Objective Structured Clinical Examination, or OSCE. Specifically, the DVD will advise examiners on what is OSCE, how to prepare for OSCE, and the conduct of OSCE and related quality issues. The Irish public expects its paramedics to respond quickly and provide pre-hospital life-saving care. Paramedic training is designed to impart the knowledge and skills required to operate in this difficult arena. Training is intensive and requires hard work and dedication to reach the required standard. At critical points during the process, the candidate is required to undertake 2 practical skills assessments. FEC examiners are expected to be highly professional in their approach to these assessments in what is a high-stake national examination. Objective Structured Clinical Examination, or OSCE for short, involves the examination of skills in a predetermined and controlled situation. An assessment sheet is utilised that breaks the skills being assessed into constituent elements. You will be provided with a tablet PC preloaded with your station assessment sheet. The assessment sheet is standardised to ensure that each candidate undertakes the same examination. Examiners must never deviate from the assessment sheet. The OSCE examination is a circuit of individual skills that are assessed concurrently. At each station, a different skill will be assessed. The circuit is controlled by a circuit coordinator. A series of voice commands direct the candidate's actions throughout the circuit. At the signal, the candidates are brought to their starting position.
Enter station.
Each station lasts 8 minutes.
Time is up. Please leave station.
The candidate moves to the next station. There is a 2-minute rest period between each assessment where examiners return all equipment to the start position so that the next candidate has the same assessment start point. The candidate now begins the next station. The examiner should arrive at the examination centre at least 1 hour before the examination. You are now acting as a FEC representative and are expected to wear business dress. A FEC staff member will sign you in. You will be given your examiner identification. You will also receive your examiner's handbook, which contains paper versions of the relevant assessment sheet, the required scenarios and examiner feedback forms. You will then be directed to the location of your assessment station. Having switched off your phone, you should thoroughly check and lay out all the equipment that will be used during the assessment. The examiner must be certain that the OSCE will run smoothly. Try to anticipate the candidate's movements. You will achieve this by planning and rehearsing how you intend to run the assessment. Remember to refer to the examiner's handbook for guidance. Once the circuit starts, the assessment cannot be interrupted or stopped. Check that your tablet PC is working by entering a test code. An IT officer is on hand should you encounter any difficulties or need direction. Let the circuit coordinator know when you are ready to start. Each assessment station door will be clearly marked with the assessment identification. At most stations, you will be required to read a scenario to the candidate. In some situations, there will be a scenario on the door. The candidate will read and be familiar with the scenario before entering the station. If you have been assigned a patient or an assisting practitioner, you should brief them at this point.
Before we bring in the candidate, I'm just going to demonstrate to you what exactly the candidate is going to be expected to do.
Make them aware of how to react and respond to the candidate during the assessment.
There'll be my palm to your palm and placed at the cheek. Grabbing the knee, I will then roll you towards me onto my knees.
Patients and assisting practitioners should not be allowed to influence the outcome of the assessment. Misleading or ill-timed reactions may cause unfair situations to develop for the candidate and may lead to a candidate lodging an appeal. Remember, at this point, most candidates are nervous and apprehensive. The first encounter is critical. Handled correctly, it can greatly reduce stress. To ensure that no assessment time is lost, take the candidate's identification sticker during the 2-minute rest period and enter their details on the tablet PC. When the candidate enters the room, introduce yourself and the station by name. Ask if the candidate is ready to proceed, then begin the assessment.
Okay, this is the airway management station,
Okay.
and what I'm going to ask you to do in a moment is come over here and do a trauma jaw thrust. Are you ready to start?
Absolutely, yeah.
Perfect.
Your communication with the candidate should be friendly and businesslike. The examiner's role at this point is to confirm whether each element on the assessment sheet has been performed. Follow the assessment sheet precisely. Examiners must not ask questions or create clinical situations that are not indicated on the assessment sheet. During the OSCE, the examiner must remain totally objective. You will mark each element solely on the basis of its successful or unsuccessful completion. Simply put, ask yourself, was the element performed correctly? If so, tick yes. If not, tick no. Overall pass or fail grading is not a matter for the examiner. Before finally closing the assessment record on the tablet PC, confirm that the candidate is finished. If there is time remaining, the candidate may sit and prepare for the next station. You can engage the candidate in general conversation, however be careful not to discuss matters relating to the assessment or the candidate's service or institution. Should any problems arise during the circuit, contact the circuit coordinator. You will be directed by the circuit coordinator as to the best course of action to take. When a problem arises, the examiner will, where possible, continue with the assessment without interrupting the candidate. Finish the assessment as normal and contact the circuit coordinator during the 2-minute recess. In this example, the tablet PC has failed. The examiner immediately reverts to paper and continues. He contacts the circuit coordinator as the candidate leaves. Margaret? I'm having a problem with my PC. I wonder, could you call the ICT officer, please?
Absolutely, yes.
The circuit coordinator has called the IT officer who is assisting the examiner.
Okay, that should be about it. You recorded the last student on paper?
Yes, I did.
Okay, can you make sure that paper comes back to me at the end of the circuit?
Will do.
Lovely, thanks a million.
At some point during the assessment, a member of the quality committee will enter your station during the 2-minute recess prior to the candidate's entrance. Their function is to observe your performance as an examiner. Should any issue arise regarding an assessment, the quality committee will arbitrate on the matter and advise the registrar. When the circuit ends, the circuit coordinator will assign a time for the start of the next circuit. Examiners must return at the appointed time. The circuit cannot start without all examiners being in place and ready to go. If patients or assisting practitioners have been assigned, please ensure that they also return to the station on time. FEC encourage examiners to actively participate in the internal quality process of the assessment by providing feedback. The Quality Committee carefully reviews all examiner comments. Here is a short sequence of examiner and candidate interaction, along with some real comments from candidates.
What I'd like you to do is to perform a radial pulse check on this patient, please.
Okay.
His refs are 16 a minute, normal and regular.
This DVD has provided clarity on what is OSCE, advice on examiner preparation and setup for OSCE, and information on the conduct of OSCE and related quality issues. Students train hard to arrive at the point of assessment. The function of a FEC examiner is to provide a competent and professional assessment. The reputation of OSCE as a fair and equitable process has been established through the hard work and dedication of FEC's examiner panel. Your professionalism will help to build on this reputation.